Good afternoon. I'd like to call to order the Caldwell County Department of Social Services Board Meeting. Today is Tuesday, July 27th, 2021, and it's 5 p.m. here in the Alden East Orange Building. With that being said, we will have our Pledge of Allegiance, which will be followed by our invocation by Reverend Keith Gillum of the Living Hope Church. Please face the flag. Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you for joining us this afternoon.
Thank you. May we bow our heads. Father, we give thanks today for your goodness in our life. For the many blessings, God, that you've given to us, we say thank you. We ask this evening for your hand to be upon this board, that you would give them guidance and wisdom, and we are grateful for all those who serve the families of Caldwell County. Father, we trust you to provide the resources that are necessary to serve those that are underprivileged, and we just pray, God, for your hand to be mighty upon the people of this county, that we would honor you and serve you and see your blessings. Thank you for everything that you're doing. Thank you, God, for moving and working in ways that we can't even see or imagine. And we just trust you. We pray this in Christ's name. Amen.
Amen. Thank you, sir. We appreciate you doing that, and thank you so much for being here with us this afternoon. All right, next on the agenda is the swearing in of myself, and we're going to have Thomas Welch come and do that for me and for us.
If you will, hold the Bible in your left and raise your right. Repeat after me. I, Donnie Potter,
I, Donnie Potter,
do solemnly swear
do solemnly swear
that I will support and maintain
that I will support and maintain
the Constitution and laws of the United States,
the Constitution and laws of the United States,
that I will be faithful
that I will be faithful
and bear true allegiance
and bear true allegiance
to the state of North Carolina
to the state of North Carolina
and to the constitutional powers
and to the constitutional powers
and authorities which are or may be established
which are or may be established
for the government thereof,
for the government thereof,
and that I will endeavor
to
support, maintain, and defend
I will support, maintain, and defend
the Constitution of said state,
the Constitution of said state,
not inconsistent with
not inconsistent with
the Constitution of the United
the
States.
Constitution of the United States.
I, Donnie Potter,
I, Donnie Potter,
do further swear
do further swear
that I will execute the duties
that I will execute the duties
of the office of
member
of the Caldwell County Department of Social Services Board
member of the Department of Social Services, Caldwell County Department of Social Services Board,
to the best of my will and ability,
to the best of my will and ability,
according to law,
according to law,
so help me God.
so help me God. Thank you, sir.
Yes, sir.
Appreciate that. Thank you, Thomas. Yes, sir. All right. With that being done, a couple of those lines, he got a little long on me there. My memory ain't that good. So next on our agenda, we're going to ask for if there's any amendments to the agenda, because we do have one.
Mr. Chairman, I would like to ask that we take item number 4, and postpone that until our next meeting.
All right, so item number 4 for the folks watching at home is the elections of the officers to the board. And we have a couple members out this evening. And I felt like that for us to elect officers, I felt like we all need to be here to discuss that and be involved in that. So with that being removed, I need a motion to approve the change in the agenda.
I'll make a motion to approve the agenda with the amendment.
I second.
Have a motion and a second. All in favor, please say aye.
Aye.
All opposed. Motion carries. Next on the agenda is the approval of the minutes. I need a motion to approve the minutes from last meeting.
I move if they be approved as written.
I'll second.
Have a motion and a second. All in favor, please say aye.
Aye.
Aye. All opposed, motion carries. All right, now we get down into the meat of the meeting tonight, and number 7 or actually that's number 6 on our agenda will be reports. And the first one's going to be Family First Prevention Services Act. Ms. Kim Arnett, Children's Program Administrator.
Good afternoon.
Good afternoon. Always a pleasure to see you.
Thank you. You as well. Let me see if I can get everything set. I don't know if I need that. But bear with me as we talk about this, this act, this law. I know we've talked about it a little bit, but we thought that it would be a good idea to talk about it a little bit more. Going to try not to get too down in the weeds with it, because if I do, then that would take a very long time. But we're going to hit the basics. Will's going to jump in with some input. He has a little bit more exposure to the conversations about this, because with the Directors Association, you know, they talk about this quite a bit more than right now with supervisor level and county level. So let's first start with there we go. So what is the Families First Prevention Services Act? So they refer to this because, you know, the state always likes acronyms, and so they call this FIPSA. So what is FIPSA? So it is an act that was passed, 3 years ago, and is really the most sweeping legislation to impact the funding and programs in decades. Has quite a few provisions, but the ones we're going to focus on and the ones that are really prominent for us are prevention services and limitations on funding for congregate care. And we'll talk a little bit more about what congregate care means in just a minute. So what FIPSA is really aimed at is focusing on strengthening families and communities. It's really an opportunity for states to envision an improved way of serving children and families. So we're looking at, you know, a practice model within child welfare, safety organized practice. We're looking at a lot of other parts of this broader vision for child welfare services. Parts of that are systems should keep families together by providing prevention services, because you've heard me say, probably heard Will say a lot of times, we're reactive. Because of statutes, we have to be reactive, and the limitations that we have. So this is really trying to branch out and provide more preventative services. Another part of that is children should be placed in a family-like setting whenever possible. So it's really trying to reduce those group home settings, those congregate care living settings. And when possible, or when not possible, to be placed in a family-like setting, it should be in the least restrictive settings that meets their treatment needs. And so to do so, the state is aiming to develop a comprehensive, accessible, statewide service array that, you know, will result with families being supported, so children are less likely to come to the attention of CPS in the first place. When children are reported to CPS, we really want to be able to provide more services to keep them safely at home with their families. When they do have to enter foster care, we want more services, or the state is hoping to be able to provide more services, assisting parents to make changes to safely and quickly reunify with their children. And when they can't be reunified with their children, that they achieve a permanent family or a permanent placement or permanent option as quickly as possible through perhaps adoption and guardianship. Some key components of this act are that it allows 4E reimbursement for approved evidence-based services to prevent entry into foster care. So I'm going to translate that a little bit. So 4E is federal funding. And we've talked about different funding streams that the department has. We have state funding, we have federal funding. The federal funding, we get reimbursed at a higher rate. So 4E is that federal funding. And so for right now, the only thing that 4E funding can be used for is children in foster care. So this is, well, there are some other things, but that's a small percentage of cost. So this is going to expand that and provide that reimbursement on the federal level for certain services that are evidence-based, that are approved by the state, by the ACF, to prevent entry into foster care. It will also, with giving that, giving more money into the prevention, it's also going to limit some federal reimbursement for congregate care. So that means children placed in congregate care, they will be able to get 4E reimbursement for the first 2 weeks of placement, but not after that. And so there's some exceptions to that, and we'll see that in just a minute. It does incentivize placement in a family-like setting, obviously, because it reduces funding for the congregate care. And it does define a minimum standard of care, and for QRTPs, which is qualified residential treatment programs, and we'll talk about that in just a minute, as an option for children who who may need that congregate care setting. So QRTPs is a different type of treatment facility or foster care placement. So this is the recommended regional support map. Looks like, 7 different regions that they're going to be looking at. I don't know if that's changed. I don't know if that's still the same. So they're looking at, evidence-based services, serving those regional areas. So, we'll see if that changes, but as of now, that's what it's going to look like. So prevention services. So this allows, the part of this act allows states the option to use that federal money for trauma-informed evidence-based prevention services for eligible children and their families. So not just the children, but also services to their families. So the programs that are going to be reimbursable will have to be approved by the Administrative Office of Children and Families, the ACF, and identified on the state's 4E prevention plan. Talk about that in a minute. So the people who would be eligible for these prevention services, who would be candidates, they are candidates for foster care. That includes parents, children, and kinship caregivers. Children and parents are eligible without regard to their income, because currently now 4E has an income eligibility part to it. There are regulations that say 4E is the last payer, so if insurance pays for these services, that insurance would have to pay first, and then the federal reimbursement can kick in. The evidence-based programs must be approved by this federal clearinghouse, which is an independent systematic review process. It's been developed with the ACF and North Carolina Department of Health and Human Services to rate these programs, to do research on these programs, and they have a rating system that they'll use to make sure that these programs satisfy all of their requirements. Anything else you want to say about that? You just jump in.
Let me ask you a
Okay.
quick question right there.
Yeah.
So I'm assuming that anybody that's in congregate care today would not be affected by this.
Right. They'll be kind of grandfathered.
Grandfathered per
Yeah.
se, okay.
Yeah.
So as, and my understanding is they're gonna sort of try to, through funding, they're gonna reduce the congregate care more into foster care.
They are, these, a lot of these private agencies that have congregate care settings are looking at and currently making plans to license like family foster homes and different types of settings so they can still.
So they can still get that.
Yeah, yeah.
Is that, I guess, lack of a better term, is that a good thing? That,
Yeah, I
mean,
think it is a good thing. I think some congregate living situations are great for children. Some children need that.
Yeah.
And so these QRTPs, these Qualified Residential Treatment Programs, not sure if North Carolina is going to engage in those or develop those, but if they do, for those children who need that type of setting, hopefully that will be what they can, where they can go and still receive that funding.
Okay.
So North Carolina has to submit their 4E prevention plan to the federal government. I think it's supposed to happen in July. As of yet, we have not submitted that. It's a 5-year plan. We also have to identify that candidacy pool. So we have to identify the definition of a candidate and figure out what the eligibility criteria are. I don't think that has been done at this point. Where you see at least 50% of the total 4E expenditures must be at the well-supported level, that's when I was talking about that rating system. So that the ACF clearinghouse is going to rate those programs, and it has to be to that level before they can be reimbursable. And again, 4E will be the last resort in regards to payment, because Medicaid will pick up first or private insurance will pick up first. So the evidence-based programs, that, those are going to be monitored by the state, evaluated by the state. They are going to the state will fund that. There should be, which hopefully that will create some uniformity and consistency across the regions, across the state. They will monitor the fidelity of those, what they call EBPs. Like I said, we always have to have an acronym, so it's an EBP. There'll be no cost to counties for these programs. Hopefully will result in fewer children entering foster care. That is the goal of these, these evidence-based prevention programs. So currently, we have a few that are rated as well supported or supported. Home Builders, that's an intensive in-home skill building program, support for families, parents as teachers, and Triple P parenting. So we also, MST, methadone maintenance therapy. It's also an evidence-based program or practice, but it is funded by Medicaid. So like we said, 4E reimbursement will have to be the last payer. So since Medicaid funds that, we don't see that particular type of treatment will be reimbursable.
And those three are in the county?
Those three are at the state level right now.
Oh, okay.
So some counties have them. We've been looking into Triple P, doing some research into Triple P, thinking about bringing that into the county, getting some of our staff trained in that. These are in certain counties, and I don't know if you want to.
We used to have parents as teachers.
We did.
I don't know if you remember if we still have that program
You know,
locally
I'm
or
not sure if we do still have it. It seems like maybe it
We
went
don't.
away
I
at one
reached
point.
out to the Family Guidance,
Yeah,
and
as it
Family Resource
as it
Center.
started to kind of receive less funding, they were going into the home and doing
Yeah.
the services, but I think it is.
Now we use the
no.
Nurturing Parent Program,
Right.
and so we don't use parents as teachers anymore.
And I will say, one of the big concerns as this transition takes place is really for counties, kind of like Caldwell County and smaller counties who are not in some of those metro areas, is really looking at the state to say, how are you going to recruit and really support areas like ours, making sure that those programs that are great and sound great and all of that, to make sure that we have enough of those programs locally so that we can use them. Because otherwise, if we're having to send families, quite frankly, you try to send a family to Hickory or to,
It doesn't work.
Nope.
so that has been something that we've talked a lot about with the
Yeah.
state, to say you're really going to have to work hard to help make this happen.
And we run into that now.
Yeah.
We have, Hickory, Catawba County has a ton more resources, and then even other counties, up the mountain has more resources. And to hire the staff to work with our county or surrounding counties is tough for those businesses. And then, they can't hire the staff if they don't get the referrals, but we can't make the referrals until they get the staff. It's a constant pull with.
What come first, chicken or the egg?
Yeah,
Exactly.
yeah.
Yeah.
So here's some facts about Congregate Care. So youth and congregate care settings prior to October 1st will continue 4E reimbursement. That's just what you were asking
Yep.
earlier. For the duration of that current placement. So the way I understand it, if they're in one congregate care setting now and they go to a different one, if they change placements, it will affect them. But if they stay in their current placement, they'll be kind of grandfathered in.
Gotcha.
So youth placed on or after October 1st in congregate care settings will not receive 4E reimbursement after the first 2 weeks of placement, with a few exceptions: pregnant and parenting teens. So that's, that'll be different because we have certain places that allow pregnant and parenting teens. Young adults in the expanded foster care program, youth determined to be at risk of human trafficking, and those placed in that qualified residential treatment program setting if North Carolina does decide to use that. So the diminished revenue is only for those 4E eligible youth. This does not impact those youth that are being funded through the state foster home funds. So that's the difference in that reimbursement. We talked about the state, the federal. The state's a lower reimbursement. So the other part of this is 50% of the population of children in Congregate Care across the state, 50% are 4E eligible. So that affects 50% of those
Wow.
children in those Congregate Care settings.
Seems like a lot.
So when you look at that, you think, okay, well, it only affects half, but that's half.
That's a lot.
Quite a bit. For us, I ran our statistics, and 11% of our children are in Congregate Care settings, which honestly I think is, obviously, it's definitely lower than the state average, which I think is fantastic. Of those 11%, 69% are 4E eligible. So it will affect quite a few of ours if they have to change placements. So
Now, when they go to Congregate Care, is that because you can't find other sources, or is it because of their needs kind of require that
it can be either.
setting? Okay.
Either or both.
Okay,
Yeah.
all right,
You know, typically that's not our first, we don't start with that.
right.
And I'll talk about some ways that we've tried to look for placements outside of Congregate Care in just a minute. But yeah, typically that's not our first choice. Sometimes we have large sibling groups that we can't place together in a family foster home. So it is sometimes an option to go to a Congregate Care setting so they can still be together. That's rare too. We try to do our best to keep them placed in a family-like setting. So Congregate Care, just for your information, is a placement setting that consists of 24-hour supervision for children in highly structured settings such as group home, residential treatment facilities, or maternity homes. So that is when you're talking about Congregate Care, that's what you're looking at.
Okay.
So QRTPs is a high-quality treatment setting, and after October 1st, it is one of the 4 federally reimbursable non-foster family placement settings. PRTS, if you've heard of these are kind of hospital settings somewhat. They're psychiatric residential treatment facilities. They are locked facilities. They are Medicaid. They are Medicaid funded. So they do not receive the foster care board rate, and so Medicaid will pay first for those. So this is where I was saying that we're not sure if North Carolina is going to use the QRTPs. I don't know if you've heard any more about that.
I mean, I think they are. I think the question is, how long is it going to take them to get up and running? Because different facilities may end up being a QRTP, but they have to go through a certification process. And that's another one of our concerns with the state, is to say, those sound great, but how long is it going to take to get this process up and rolling? Because everything starts October 1st.
Which is not very far away.
Which is now.
Yeah.
Yeah,
But everything is not in place.
And so, how long
well,
is
that's
it going to
typical
take?
state.
Exactly.
How long is it going to take?
Put the cart before the wheel.
What's the eligibility criteria going to be? And are these agencies going to be able to afford to meet all those requirements? So
Yeah.
there's a lot of questions still.
Yeah, that's just typical state, but we're used to it,
So-
right?
Yeah. So what are we doing to plan for FIPSA? So one of the things the state's asking counties to do is move children under the age of 12 to foster care family-like settings. And so, we will be looking at who we have in Congregate Care settings to see if that's a possibility. We also have to consider, do we want to disrupt placements if they've been there for some time and, they're still going to be 4E eligible in this setting, and so do we really want to disrupt their placement because of that? We have, as you know, we have a social work 2 position that came to us, came to child welfare through another from another area in the department. And so we have titled that position a placement coordinator. And so what that individual helps with is she helps with relative finding. So anytime we take children into custody, she sends out relative notification letters and asks for interest in placement. which is required. She does that within 30 days of the children coming into care. She also helps find placement for children who disrupt or new children who are coming into care. You know, we obviously need more licensed foster homes. We need more kinship homes. We need support for these kinship homes and these foster homes. We need access to behavioral health. We need access to mental health. We need quick access. We need respite for our caregivers. We need a lot of things locally and statewide for this to really take off. We need expansion for crisis supports for children and their caregivers so that when you have a child who's disrupting because, you know, these children have been through trauma, they don't know how to regulate their emotions, and they're acting in a way that they find to be normal or a way that they cope. Sometimes these caregivers can't handle that, and so we need some support, some crisis supports for these families. So there's a lot of things that we need as a state and as a county to really help this take off and be successful.
Have we, I mean, to interrupt you, but have we, like, connected with, you know, we have a great resource here in Caldwell now, Jonas's Ridge. Have we made any connection there for this, any type of assistance, or have we leveraged that anyway?
Yeah, we have. Jonas Ridge, though, is only for adults at this point. They don't have a children's
Unit. Yeah.
yet. Now, we have asked them to please consider that and look at that.
Well, they got 27 rooms, but maybe they could put 2 of them.
I wish.
We have told, and I think other people in the community as well have said, you know, when you kind of get this thing up and running and moving, we
Let's
would
expand.
love for you to look at
Yeah.
a children's.
Yeah.
Yeah.
That-
Yeah, 'cause that would be a
highly
great, that'd be a great asset to have right here.
Highly needed. So some of the resources that the state social services are planning to provide to transition away from congregate care is, you know, help with staffing of all children under the age of 12 in congregate care, sending out lists of private agencies that license foster home, giving access to caring for our own and expansion of kinship care, kin gap. It's a incentive for relatives to become licensed to take guardianship of children and their families, and just technical assistance, meaning our regional consultants helping with finding placements for those children or helping to talk about those situations. And so there will be some bridge funding whenever this implementation starts, and I'll let you talk a little bit about that.
Bridge funding, basically what we have asked and what the state has said they are looking at is asking the General Assembly to put in some additional funding or hold counties harmless for some of the loss of funding over the next 2 years. Because as Kim's talked about, you know, the idea is that you put money on the front end for prevention, but what you're doing is you're kind of taking away some money on the back end, and that, you know, that takes time for that to occur. But in terms of, you know, the act starting, well, October 1st, it starts. So in the current state budget, there is bridge funding, asking for that funding to last over the next couple of years to help as that change occurs. So our hope is that that does get passed. As we know, you know, the state budget is you know, right now it's kind of bits and pieces. They're passing pieces of it here and there. So DHHS has put that in there and asked that bridge funding be there to support counties as this process occurs, so that, you know, yes, we look forward to having this additional money on the front end, but right now you're going to be hurting us on the back end. So create this bridge over the next couple of years to get us all moving forward. So that is our hope. For us as a county, you know, we do realize, as Kim talked about, there's certainly going to be, excuse me, you know, some budgetary impacts potentially in terms of what we can draw funding for the children who would have been 4E, or for the children who may move and had been 4E and will no longer be 4E. And, you know, I think for our county, and Chris, you can feel free to jump in. At this point, we feel pretty good about where we are. We will certainly see some loss in that funding, but at the moment, we don't see, I'm not going to, we don't see a massive impact. But we do know that it will have some budget implications for us, certainly for the state as a whole. But I think as Kim mentioned a while ago, we've done a pretty good job of not having large amounts of children in congregate care, and also of that percentage that's in congregate care, not all of them, certainly a chunk of them, but not all of them are 4E funded. So that it won't, there's a number of them that it won't affect. But we do know that there will be some budgetary impact for us. Our goal, as we start to move through this period of transition, is A, we hope that bridge funding comes through, and then B, our staff have really done a good job of placing children with family, have done a good job of placing children initially not in congregate care settings. So our goal is really going to be to, continue to work hard at that. But we know that there will be a budgetary impact. It is impossible at this point for there not to be.
And I think it's going to take some time for us to see the benefit of the prevention services. And so that's going to take time to get into that and really see the benefit. So
Well, it goes back to Will's analogy, his river analogy with the
Yeah.
kids falling in the river,
Sure,
and
yeah.
everybody's standing back here trying to catch them before they go over the dam. And Will's analogy has always been, we got to figure out how they're getting in the river.
Yeah,
You know?
exactly.
So-
And it takes some time, and then, it's going to take some
does.
time to get those services in place. And so, I'm not a real patient person, so I like things to happen.
Really?
And so, I don't know if you know that about me.
I haven't figured that out yet.
Yeah, I like things to happen. I like for change, especially, positive change, I'll say.
Yeah.
I like for it to happen, but it is gonna take some
I know
time.
somebody else that's kind of like that too, so
Yeah.
can't say much about it.
So, some key takeaways with this act are, the limit on the congregate care funding, those 2 weeks, for any new placements after October 1st. Changes how federal funds are allocated, incentivizing the prevention, de-incentivizing the placement of children in congregate care. And just like we were talking, it takes time. System change takes time. And so I'll be looking into those, services, evidence-based programs, looking at those QRTP eligibility criteria and what it's going to take for these private agencies to start to, be able to become a QRTP, looking at the effectiveness of those prevention programs, and then just changes, actually, internal statewide changes to our business process and payment and data management systems. So that, that's the technical piece of it. So that is the basics.
So is
There's
there
a little more than basics, but
Yeah, that's pretty good. I like it. You did a good job on that. Is there, I guess one question I've got, is there, what drove this? What was driving this decision? Is it because we feel like that the kids are in better placement if they're in a private home setting or versus a congregate care? I mean, what's driving this change? Do we know?
I think it's a number of things. I think that is one. I mean, just the data will tell you kids have more successful outcomes when they're with
Sure.
family or in family-like settings. I don't know if you want to,
Well, I think the other piece is really, as Kim mentioned earlier, and we've talked about before with child welfare, it is the services, your funding is really tied to reactionary things. And so I think from a federal standpoint, it's kind of one of those, everybody kind of knows it, but we've not really acted this way. And that is, if we work more from a preventative side, then, that would be beneficial. And so that act was created. I don't know the timing of it, of why it all of a sudden popped up at the time it did, but there were a number of group of bipartisan support of, we need to do something that is really more around prevention. And because we believe, sure, we can house children and that kind of thing, and we can pay for that, but that it costs money. It creates situations where children's lives are, we know they don't always have good outcomes. So let's do something different as a nation and really work on the prevention
Right.
side of it.
we know that children are more traumatized when they're removed. It's just another type of trauma. So what can we do to prevent
Yeah.
even
I mean,
more trauma.
I think it's definitely got some positive
Yeah.
outcomes. The other question is how will this affect the current congregate care facilities? I mean, are they aware of it?
Oh, yeah.
So-
They
are
are,
aware.
Yeah.
and so they are, most of them are really working hard to change their model of service.
To fit this.
Yes.
Because
And-
they know, for them, I mean, that's gonna be a huge
That's gonna be a huge
shift.
hit. Mhm.
Are they gonna
Well-
try to do some hybrid stuff and
Yes.
have?
They are.
Yeah.
Yeah,
There, like I had said earlier, they are now, well, several that I know of that we work with frequently are, licensing just family foster homes. So they're starting that process where before, it was only a congregate care setting. So now they're branching out to offer family foster home licensing, as an option and more family treatment models.
and is congregate care a more expensive model of care than, say, family foster? Or is it about the same?
Gosh, I mean, I
a good
don't
question.
know.
Yeah.
I wouldn't know about that.
I mean, I would think it would be,
it might be, but.
based
I
off the
would-
numbers, I would think it's probably more
Yeah,
expensive.
some of the expenses they have just for the facilities, possibly so.
And probably around the clock staffing and. that kind of
24-hour.
thing. Yeah.
I know that there was a specific gentleman that I spoke to probably a month ago that was working on creating one in Alexander County, and this law slowed them down
Yeah.
Yeah.
from breaking ground. They've got the property bought, they're moving forward, but this particular bill made them just take a step back and go, wait a minute, maybe we need to do something
Think
different
about a
here.
different way to
Yeah,
approach
yeah,
that,
they gotta go back and kind of redesign their programs and
Yeah.
stuff.
I will
because
say
of this.
too, when we think about prevention, we think about outreach.
Yep.
We call it outreach. And so that is something that, we're limited in what we can do because we have to provide other services that are mandated and necessary. But we have started doing that when we can. And so, we're hoping that we can do that more and more. But staffing for outreach is tough. And so that is something that we'll be keeping an eye on as we go forward, like how much are we doing and how much of a need is there? So,
Are you planning on to make this presentation to the commissioners?
We
were you trying to
can,
schedule me to
Yep.
present?
probably, I think
Wink,
probably
wink,
what we
nod,
wanna,
nod.
Yeah,
what we probably wanna do is
whittle that
hopefully.
down maybe a little bit.
Well, get the state, get them a little bit further down the road to where their plan is actually turned in.
Yeah.
And they have some bones to it.
Yeah.
It's supposed to be July, but we have 4 days left in July, so I don't know how that's gonna go.
Well, I just thought, as a commissioner, turning my head around,
Yeah.
it'd be nice to know that type of information and how it's gonna filter down
Yeah.
before it filters, is
Yeah.
my thought, is
Yeah.
kind of a heads up, maybe you cut a little bit back, but not, it's because
Oh,
it
yeah.
didn't take you long to do it, but
Yeah.
Yeah,
bring it back to us and maybe August, September, let us kind of give us a
yeah. I think
preview of it.
That is a good idea. I think, I do hope that the state has some more, structure to our plan so that we know a little bit more about how it's truly gonna affect the counties.
Yeah, because I can almost promise you, typical federal government, state government, somewhere along the way, county government and city government is going to end up having to pay more. They're probably not telling you that right now, but I promise you that's in the back of somebody's mind.
Yeah.
It's coming.
And that's the.
It's called unfunded mandates.
Yeah.
They like to,
And that is our concern, is that the trend, getting to where everybody wants to be is great, but that transition is gonna
Yeah,
Yep.
take a while.
Well, great job as always, Kim.
thank you very much.
All right. Everybody pull out their bells and whistles and their little twirly hats, and let's welcome our financial business officer, who's going to give us our financial report, Chris Conley. Good evening, Chris.
Good evening. You're much too kind, as always. Our June financial report, reimbursements for the month totaled $895,820. Our receivables were about $1.2 million as of the end of the month. June expenses totaled $999,777. So our county dollar expensed for the month came in at $103,957. Looking at our year-to-date comparison to prior year, expenses were down at the end of June by a total of $112,909. Revenues were up $243,854. So our county dollar at the end of June was $356,763 lower than prior year. So, of course, next month we'll have a recap of the prior fiscal year, but overall, we're in pretty good shape.
Yep, y'all have done a fantastic job of managing the budget and
Thank you.
making your way through it, because it's constantly changing and moving for sure.
Something's always changing.
That's right.
Part of working for this department.
That's right. Anybody got any questions for Chris? Well, Chris, as always, we appreciate you coming and taking the time to share this with us. So
Thank you.
Good seeing you, my friend. Next on the monthly updates is going to be the director's report, Will Wakefield.
Last month, I talked about a lot of hiring and some of our turnover, and so I'm gonna knock on wood. We've done a good job with filling a number of positions, so that's going well. We have some other positions that we're going to be ready to fill here soon. So we're, I think, again, knock on wood, kind of getting back to where we like to be in terms of our turnover. So we want to keep going in that direction. A couple other things I mentioned last month about some of the work groups that our county has been a part of in terms of some of the funding, some of the recovery funds that have come down from the federal government to the state, to the counties, to the municipalities. And so I've been on a part of several of those work groups, and that's going well. I think we've been able to talk about areas that and give our input to the state about where some of that funding needs to go, and so we've had good communication. My main concern, or one of my main concerns, is really for counties that are like Caldwell, kind of our size, and making sure that we have some say, we have some input into those decisions, and that's something that is important to me. One of the areas that we believe we will see some increased funding is within child care. A part of that will be additional funding for child care in general, but a good piece of that will really be around helping those centers, the child care facilities, to help increase some pay for their staff, to help create some opportunities for their own development, to where those entities can do better at what they do and the services they provide. And I think also kind of a nod to the struggles that some of the facilities have had during COVID. So that will be good. That will certainly serve a lot of the facilities in our county and help those facilities. One of the other areas that we've talked a lot about, and of course we talk a lot about here anyway, is mental health resources. And we know that mental health is a struggle for everyone. The families that we serve, we see a lot of mental health issues. And so we have asked that the state really focus on how to get some of that money into the mental health arena, so that services can be provided to those families who are in need, so that mental health facilities will have what they need, but also the creation of more resources to counties, and again, specifically counties, like Caldwell, where maybe there's not always as many providers. So that's been good. The discussions have been good, and we will continue to work at that. And I will keep you up to date as I hear more and learn more about those areas.
All righty. Anybody got any questions? All right, next on our list is Children's Services highlights. Ms. Kim Arnett again. Children's Services Program Administrator.
Talked a long time this afternoon, so I'll try to make this brief. So you have the data for June, I think, in front of you. Not anything really that's an outlier there, just staying pretty consistent. Our reporting had gone down a little in June. It always does that over the summer. We expect that to pick up again as school starts back. Our foster care numbers are staying pretty steady where they are. Our foster care 18 to 21 are staying right around 15 to 16, which according to our regional consultant is quite a high caseload for our 18 to 21. So we do a good job of really helping those youth and just encouraging them to take part in that program. So I think I mentioned about our motivational interviewing training that we were trying to get set for our social workers. We were able to get that set. The trainers are coming August 19th and 20th and August 26th and 27th. So they will be training all of our adult services social workers and child welfare services social workers. So this is a type of interviewing that really aims at overcoming resilience to change. So we really are excited about that and hope that it helps our families that we work with to really look at some behavior change and helping them, really see what is going on, see what their behaviors, what the consequences of those behaviors are, and look at trying to make some changes there. So excited about that. We are requiring that all of our staff go through that.
2 days?
2 days, 2 full
Is
days.
the training 2 days, or is it just 2 days, like one group, second group?
No,
or is it-
training's 2 days.
It's 2 days long. Okay.
2 days, 9 to 4:30. So they'll be training all day.
Would that training be open to board members, if anybody wanted to
I
attend?
think that at this point, we have 2 cohorts, and so the cost for the training is really per cohort. So I think that, it's not limited to, now it is limited to a number of people. And I want to say they were saying 30 was really their max.
They like that size, but
So we have about 61 people that we're training, so it's right at their max. But I'm sure if someone's interested, we can talk to them about
Okay.
getting
I didn't know
involved.
if anybody might be interested. Sounds like something might be interested in.
Yeah, we're hoping we
Sit
might
in
can get
on.
them back for some other trainings. We'll see. They have different phases of this training. This is the basic kind of entry level. They also have a second and a third phase to it. So
maybe
it's
if
just
a
very
board-
expensive, so we're starting
Right.
where we can.
Well, I was going to say, maybe if a board
And
member
so-
was interested, they could just
just let
drop
us-
in.
Oh,
Yeah, yeah,
Sit for an hour or
absolutely.
two and then leave,
Just kind of
There
audit
you
it
go.
in a way, yeah.
Audit it.
Yeah.
Yeah,
Let us know,
yeah.
and we'll be glad to.
Yeah, sure. So we'll be.
That might be the way to do it.
Yeah, and we'll
Okay.
be on the 3rd floor in the bigger conference room on that 3rd floor, so.
So I will say this too, for folks that are looking at, watching at home this evening, it's still, most people don't realize how many children we do have in foster care.
Right.
And right now, currently, we have 123 children in foster care. You had mentioned the 18 to 21 being 15. So, if there's anybody that might be interested in participating and being a foster parent, please reach out to our agency and share that love and that you may have in time that you may have for another child. I think it's something that I know we talk about it and we try, but we just need to keep on asking.
Absolutely.
Because there's a lot of people out there who still, I think, that are not aware that they could do that if they wanted to.
Absolutely, and we certainly need foster homes in Caldwell County.
Correct.
We need homes where children can stay in their home county, and where that will take especially sibling groups, 3 or more, and teenagers. So
So that's where your big need is?
that is where our big need is.
Okay.
Yeah,
Everybody wants the baby, right?
yeah, well, yeah, there are times, though, where you will see it's harder to place, infants, but
Interesting.
most of the time, our biggest need is sibling groups and teens, so.
That's fantastic. Thank you, Kim.
Yeah, and so the last thing I have is just about our staff development position. So we're very excited about that staff development supervisor position, and we'll begin interviews soon, and we're going to be doing some recruitment in that position, and so just very excited about that.
Fantastic.
All right, thank you.
Thank you very much. As always, great job. Next on our agenda is Adult and Family Support Services highlights. Martha Hedrick, Economic Services Administrator.
Good evening.
Good evening.
As you can see that our numbers are actually going up over the month of June. COVID policy is still in play for the majority of our eligibility programs. So as you can see, we've actually hit something we've never hit in Caldwell County before, reaching over $3 million in food nutrition service benefits.
That's a lot.
So that is quite a high number for our county, something that we have never seen before. We've actually added on a little over 3,000 in Medicaid with the COVID policy. So, our numbers are continuing to grow. Guardianship, I know, has had a lot of increase, a lot of activity going on over the last month. Adult services going pretty crazy over the last month with calls and intake. So I think all of these numbers have just continued to increase. Our customer service staff, we're starting to see clientele come back in a little bit as a trickle effect, wanting to start see workers and have that face-to-face interaction with our workers, trying to get their paperwork filled out or if they have questions. And we're definitely seeing a lot more calls coming in with the Medicaid transformation, people wanting to make sure that their paperwork was received and completed and that it has been put in the system and that it was correct, since all of that started in July. We are still working with child care and working on our wait list, continuing to work on bringing those down. The behind the scenes work, we do have some areas though that still have a little bit of lag because there's not as much activity in their areas. One area, food nutrition services and our case management, the state has taken all of their recertifications and they're just actively re-enrolling families every 6 months for their recertification period, which is something kind of unprecedented. We've not seen happen for this long of a time. It's going to go for over a 12-month period. So we have these workers that are used to working all of these recertifications and then they've been taken away. So we actually have these workers helping with intake. We've been doing cross-training with Medicaid, so they're helping with Medicaid recertifications and applications. We have some of these workers helping in customer service. We actually have been doing a lot of training with a lot of these workers as well in program integrity, training them on how to look at the paperwork they're sending our program integrity workers. Is it truthfully an agency error? Was it intentional? Working up these over issuances and going back and finding all of the evidence that our program integrity workers need before they look at these cases for hearing or for further investigation. So that has really helped out that area tremendously. So we might be slow in one area, but those people are still going full force in another area.
Mm-hmm.
Any questions?
I had one in regards to the child care staff assisted waiting list. How many we got on waiting list right now? That's always been a topic of mine.
We were at about 250. We've been working on going down because, of course, we've got school.
Right.
So normally we start going up and then we kind of lag down. Right now, we're about 220.
Okay. And have we seen, during COVID, the peak of COVID, did we see any child care centers close?
We have not had any permanently close in Caldwell County.
Okay.
We have had several that will close for COVID scare or if one of their employees has tested positive for COVID.
Right.
And we have, actually this week in Caldwell County, I know of 3 facilities that are shut down because they have positive COVID employees.
Gotcha.
And normally they're doing a 2-week shutdown or a 1-week shutdown. So then they're calling us for to try to do an emergency placement or something of that need, which we don't have. So, it has been very hairy for childcare during this COVID because there's been so much change.
And that has created a little bit of the problem with the waiting list, correct? Just because there's nowhere to place them.
Correct. And then having the parent fee paid for them, there's the extra enticement and incentive of getting on the wait list. So we've also had some issue with people wanting to be placed on the wait list and they're not eligible. So we're having to continue to field through every
So
so
they get on the
often.
wait list and knowing they're not gonna be eligible just to get the incentive.
Yes. So that's something that we're having to have our workers work very hard on, is continuing to kind of field through that list and ensure the people that are on the list truly need to be
Need
on
it
that
to
list and would qualify.
Correct. All right. As always, anybody got any questions?
No, thank you, Martha.
Thank you.
Good job.
Thank you.
Good to see you.
You too.
All right, well, that concludes our meeting tonight. If there's anybody who'd like to say anything before we adjourn, I'll open it up to you too. We don't have a very big crowd tonight, so,
Just thank you for what you do. You do an incredible job.
yeah. And I echo that. Just, as always, take our thoughts and appreciation back to your staff and let them know how much we do appreciate them.
Thank you.
Our next meeting will be on Tuesday, August 31st, 2021 at 5 o'clock here in the same location at the Out in East Orange Building. We encourage you to come and sit and enjoy a meeting and ask questions. And if you'd like to come up, this is a public meeting, so you're always welcome to come up and ask questions and be a part of the process. And we always we'd like to hear your feedback from the public. If anybody has any questions, please feel to reach out. With that, I will entertain a motion to adjourn.
I move that we adjourn.
I'll second.
Have a motion, a second. All in favor, please say aye.
Aye.
Aye. All opposed? No. Say no. Motion, meeting adjourned.